Well, people seek treatment for varicose veins for quite a wide range of reasons. At one end, you have relatively young people, often quite minor varicose veins, and they're concerned with the cosmetic appearance of their legs. Those patients, by and large, don't get treated on the health service. The next group is slightly an older group, and their veins are larger, and they get symptoms in their legs, so aching, discomfort, often itching, a sense of swelling in the legs, and they get treated to try and relieve those symptoms. And then the third group, it tends to be an older group still, often in their 60s, 70s and 80s, who have had severe veins for many years, and then they get damage to the skin around the ankle, so they can get varicose eczema, pigmentation, and ultimately ulcers. So we treat quite a lot of patients for symptoms, but increasingly on the health service, those patients with more severe disease who have skin damage and ulceration. Well, for many, many years, the only treatment available for varicose veins was surgery, sometimes called a stripping operation. That requires the patient to come into hospital, sometimes overnight, sometimes as a day case. They have to have a general anaesthetic, they have to have cuts in the leg, the vein is stripped out, and then we pull the lumpy, bumpy veins out with hooks. And although, done properly, that can be quite successful, it's got quite a lot of complications with it, things like nerve injury, a lot of bruising. And for people who are working, they often have to take several weeks off work afterwards. The advantage of foam is that the patients are done a walk-in, walk-out in a treatment room. It's done under local anaesthetic. There's no risk of any nerve damage, the risk of DVT is much lower, the bruising is much less, and the general discomfort afterward is very much less than after surgery. So many patients can go back to work the same day or the next day. So for the vast majority of patients, surgery is not necessary now. We can treat them on a walk-in, walk-out, outpatient, local anaesthetic basis with foam.